Learning about your top 5 period symptoms. Every woman's body is different, and period symptoms may manifest themselves in every woman a bit differently. Some women may find their periods to be so heavy and severe that they have to take birth control just to control them. As you start getting periods more regularly, it's important to recognize what your own period symptoms are every single month. This will not only help you track your menstrual cycle, but also be able to predict a day ahead of time when your period is coming. About 80% of all women report period symptoms of some kind. Your menstrual cycle involves a monthly cycle that keeps your ability to get pregnant intact until you're ready to use it. During your cycle, your ovaries are releasing one egg into your uterus. If that egg does not get fertilized within a few days, then your body discharges it and the tissue lining. This is the bleeding you experience every month. The technical term for this monthly cycle is menstruation. All the symptoms associated with your monthly period are commonly known as PMS or premenstrual syndrome. The most common amount of symptoms most girls feel are cramps, headache, bloating. The cramps and pain usually come within the first 5 days of your period. These cramps are essentially a minuscule version of labor pains you'll feel if you ever have children. You may additionally experience breast tenderness along with your amount and even some swelling in your hands and feet. All of these physical symptoms can range from mild to severe, and your level of comfort during your period will probably drop. You may also experience one or more emotional symptoms during your period. Depression and irritability square measure rather more common right before and through a woman's amount. Anxiety, confusion, and mood changes are pretty ground once it involves amount of symptoms. Don't be surprised if you also feel some food cravings during various times of the month. Your hormone levels will often cause you to crave certain kinds of food. It's okay to give in to these food cravings sometimes, but watch how much you give in because you could find yourself gaining a lot of extra weight. After about 2 weeks, the next egg will be released. The cycle will continue in the same way until you become pregnant or pass into menopause. Menopause usually occurs around the age of 50, so you've got several decades of periods and potential childbearing time. You'll find it helpful to track your menstrual cycle on a calendar. This will help you know ahead of time when you're going to have a period. You'll also start to see patterns in your behavior, moods, and much more. Your menstrual cycle actually affects your body throughout the month, although the changes it causes are much more pronounced around the time of your monthly period. Period symptoms: missing your period. Reasons you're missing your period. There are all kinds of reasons you could be missing your period. Of course, the most common reason you could be missing your period is because you're pregnant. However, missing your period does not necessarily mean you are pregnant. If you are sexually active and you do miss your period, then you should start by taking an at-home pregnancy test. These tests are usually pretty accurate, although if the pregnancy is at a stage under 2 or even 4 weeks, then the test may not pick it up. If you believe you still might be pregnant even if the at-home test was negative, you can always get a blood test at your doctor's office just to be sure. Most of the common reasons for missing your period are nothing to worry about. Ovulation is controlled entirely by hormones, so it's important to remember that missing your period can be a sign of many other things. If you're young and just got your period within the last 2 years, then you may still not be regular. There are also many other things that can cause your hormones to be out of balance enough to cause you to miss your period. For example, if you recently changed birth control pills, your hormone levels could be in the process of shifting around. This can cause you to miss your period. Sudden weight gain or weight loss could also be a reason you're missing your period. However, both of these problems may indicate another health problem you should have checked out. Other common reasons for missing your period include a change in vaginal rings or contraceptive implants. There are also some medical reasons you may be missing your period. All of these health problems are definitely cause for concern, so you should see your doctor and get checked out if your period doesn't come back again the next month. It's always good to know why you're missing your period. Think about whether you have any other symptoms besides missing your period. These symptoms could be the key to helping your doctor determine exactly what caused you to miss your period. Common problems that can cause a missed period include tumors, cysts, mumps, hypothyroidism, hyperthyroidism, Cushing's syndrome, and menopause. Occasionally, there might be a reason you actually want to miss your period. For example, if you're going on a beach vacation, it probably wouldn't be much fun to have your period on that trip. If you're on birth control, then it is possible to miss a period on purpose. If you want to do this, discuss it with your doctor first. However, in many cases, you can simply skip over the placebo pills in your birth control package. These pills are the ones that are a different color than the other pills. Most birth control packs have 3 weeks of one colored pill and 1 week of another color. If you're on a type of birth control that doesn't utilize this type of pill, then discuss further options with your doctor. Period symptoms, discharge before period. What it could mean. Discharge before period or menses time can be a little worrying, especially if you are experiencing unusual amounts or discoloration. You should know that discharge is quite a normal occurrence in women who have reached puberty and can simply be an indicator as to what's going on in the body. There are, however, times when discharge before period time can be a sign that something is amiss inside your body. We're going to look over a few things that are known to cause discharge before menstruation, which may help to give you a better idea of what you might be dealing with. Fertile mucus. Sometimes discharge will pop up around 2 to 2.5 weeks before your next period is due. This type of discharge is usually described as being stringy, slippery, watery, and clear. It typically doesn't have the vinegar-like scent that most discharge is known for. In fact, many women report that fertile mucus actually has a sweet scent to it. This type of discharge is not particularly tacky or sticky in consistency, although it can appear a bit jellified. Discharge that matches this description is referred to as fertile mucus. Although the term mucus may put you off a bit, that's exactly what it is, and it is a sign that ovulation will be upon you soon. If you'll remember, ovulation is the time when you are at your peak fertility during the month, so if you're trying to get pregnant, fertile mucus is a sign to start trying for a baby. If you don't want to get pregnant, then you should definitely use protection during this time. infertile mucus doesn't require a trip to the doctor, and it will clear up very soon with no muss or fuss. If you find the sensation to be annoying or bothersome, then consider wearing a panty liner to offer a bit of protection for your underwear and to reduce any mess. Bacterial infection. Certain types of discharge before the period week is due could be a sign that you are experiencing a bacterial infection. There are a few characteristics that can help you determine whether the discharge you are experiencing might be related to an infection. One of the first things you might notice about the discharge is that it is white and has a thin consistency. It will not be thick, lumpy, stringy, or stretchy. The other, perhaps more obvious, sign is that the discharge will have a highly strong odor that smells like fish. This odor may be strong enough that you smell it while using the restroom, or particularly when you wear a dress or shorts. It is usually most noticeable just after sex. This discharge is associated with bacterial vaginosis, which can pop up with virtually unknown causes. Treatment for bacterial vaginosis does require a trip to the doctor, where the standard treatment comes in the form of a vaginal suppository. This condition, if left untreated, can increase one's chances of contracting HIV and could pose health issues if you have a vaginal infection while pregnant. Subscribe our channel for future videos. Visit our website holisticmeaning.com for more informative articles.